Good morning, good evening, good afternoon to all our listeners and viewers who have joined us on various platforms. Today, we have a very special guest with us, and personally, my favorite, somebody who is a founder of a leading international podcast called Will Gather, and which specializes in aging services, caregiving, senior living solutions, and somebody in her personal life who's a very strong advocate of healthy and active aging. So let us welcome together Nicole Will from Will Gathers. And with me, always, I am very lucky to be with my co host, Pankaj. So, Peyton, on to you, Pankaj.
Thank you, Dr. Mrigna. And it's really a great pleasure to have Nicole with us for this session. And as I was telling before, Nicole and I connected a couple of months earlier. I've been following her work and was really impressed as to what she's been doing. And more than being impressed, it was always opportunity to look forward to learn from her because she has been doing so much in this field and she's been interacting with so many people. So, Nicole, welcome to the show. Thank you for coming on board, and we will definitely ask you a lot of questions, which may not be structured, but we'll definitely love to learn from you.
Oh, thank you for the kind, warm welcome. It's really a joy to be here with both of you, and I'm looking forward to the conversation and learning. I think my favorite part of the work that I get to do is meeting incredible people from around the world that have a heart for care and other people. So yes, it's a joy. Thank you for having me.
So, Nicole, thank you so much. And let us start with the questions we were so keen and so eager to ask you. So, let us start with the first thing that comes to my mind is how does eldercare sector function in US in general, with respect to the affordability and acceptability by the senior citizens, the families, and general caregivers. So, how does
Yeah,
it function? Is the first question
yeah.
I'd love to know about.
Yeah, it really is the intersection of healthcare. We have senior housing, we have social support, which is, right, supporting all of those caregivers. And the affordability is one of our greatest challenges as well. And in the US, it is a fragmented system. We have part healthcare systems, we have part senior housing systems, part caregiver support and university programs. And it often means that older adults and families have to navigate multiple different providers, multiple different funding sources, which can be really overwhelming. The costs vary widely depending on the level of care. So we have independent living communities to assisted living, memory care, skilled nursing, home care, adult day services, companion support. It really is such a plethora of different options. And while Medicare covers certain medical needs and long-term care, is often paid out of pocket. We have private insurance or Medicaid with those that have limited means, and it creates a system where our choice is often dictated by financial capacity rather than preference. And in terms of affordability, long-term care costs are high, right? For example, the monthly cost for an assisted living in the US is over 5,000 USD dollars, and nursing homes can exceed up to nine to $12,000 if you are looking at a skilled memory care community. And Medicare, which is our public health insurance for those over 65, doesn't cover most long-term care needs, and so many do rely on Medicaid for low income. We have private insurance, they're using personal savings, they're selling assets, right, home, and it creates a disparity which those with wealth can afford more options, right? And other people have those limited choices. I think acceptability has evolved over time. Many older adults value independence. They want to age in place at home, or as I like to say, I learned from Charlotte Yeh, who was the chief medical officer with AARP, thriving in motion. I love that term, thriving in motion, thriving in place. So services like home care and age tech solutions are growing. Yet, unfortunately, I do think there is still a little bit of a stigma attached to moving into a senior living community, as I like to call that, or for people when they were younger and maybe use the term or visited grandma at a nursing home. But partly, I think that the stigma comes from outdated perceptions of institutional care. We've come so far, and when you step in communities now, there are a lot that exceed in expectations, focusing on dignity, purpose, connection, as well as really great care. And the experience, I think, has evolved in offering more of those hospitality-driven experiences, wellness programs, intergenerational engagement, which makes it more appealing. And I think that we've started to educate and shift the understanding that these communities can provide really great socialization, combat loneliness, help you feel less isolated. We have a lot more options in terms of care. So my question for you both is, how does affordability and access work where you are in your country? And how do adults typically feel about formal care services versus staying at home with the family?
Yeah, so that's a very interesting question, Nicole, to be honest. And yeah, from the country that we are both from is India. Yeah, we started working here in Brazil for a while now, but our roots are based out of India. And in India, when we talk about affordability cost perspective, I think we are extremely cheap as compared to US. Even the most, I would say, hospitable uh, assisted living places are, I think, one-fourth the cost of what we are talking in US.
Mhm.
So that is a huge difference when we talk about in terms of, hospital, I mean, old age homes or assisted living facilities. And when we come to acceptance, that's a very great question because I think by the years, they are now building acceptance, but nonetheless, it's still, there is not a very great acceptance generally in the Asian community. Reason being, we come from a cultural background. I mean, the whole of Asia when I'm talking about it, and especially Southeast Asia. We come from a background where it is considered the elder child's or the child's responsibility to take care of the parents and to have them even in an assisted living home where they may be very well taken care of is seen as a social stigma.
Mm.
So still, like I said, a lot needs to be done, especially, where we come from, the country we are in right now, or the sector where we're trying to work for here. But it's very interesting, Will. When we talk about Will Gathers, I was listening to one of your podcasts one day, and for those who are new to the show and who probably do not know about your podcast, please would you love to share how did you first this whole idea of starting up a podcast, came to you, and how you would develop this whole idea because it's very interesting for me, and I have known the story a little, but I would love to hear from you once again.
Oh, thank you. Yes. For me, I think like a lot of us, we have a personal connection to someone that we love that's older. And my grandma moved in to our family home when I was 15, and that relationship really impacted my life. We had a deep friendship. I loved spending time with her. I ended up taking that relationship and care and going on to university and studying social gerontology, which is the study of all aspects of aging. And in that coursework, part of our requirement was being a nursing assistant, which is a hands-on caregiver in a senior living community or nursing home. And when I was in that environment, it was the first time I realized that this is a field of study and a career and a whole world of industry and opportunity that when you're younger and trying to decide what direction to take your life, I didn't know that it really existed, right? I remember my mom taking me to visit one of our neighbors at a nursing home, and we would go and play Yahtzee with her, which is a dice game. And I had a little glimpse of that, but I didn't understand that I could formulate that and grow my career out of that. So ended up working in a senior living community for many years that had every level of care from independent living, assisted living, memory care. We had a transitional care unit. We had 100 people that could come and stay and receive speech therapy, physical therapy, more acute care after a hospital stay or a transition, right, to their next, whether it was going back home or moving into another community, and memory care. And then we had long-term care. So really great clinical foundation for myself to learn and be in that environment, interacted with probably thousands of families as they were in and out of our community throughout the day. Older adults really developed this sense of understanding how senior living works in the US here. And from that, really decided to take what I knew from a family personal experience, what I knew from my professional life, and wanted to create an organization called Will Gather, which is an umbrella over the podcast, Navigating the World with Your Aging Loved One. I work a lot with organizations in an advisory capacity, giving insights, helping tell their story. And then I also partner and do a lot of speaking and education globally, which has been really such a gift for me to meet other people and share. And while I'm sharing, I love to learn from others as well. I love being curious, and the podcast really stemmed from having conversations with a lot of families that had a lot of questions, and they knew that I worked in aging services, and they wanted to know about moving a loved one or how do I navigate this. And at the time when I started the podcast, there weren't a lot of aging or caregiving podcasts. And what I love is that it's grown. There's more now, which is wonderful. We need all of the voices in this space, but the podcast is formulated as an interview style or conversational style as we learn and discover from people that are caregivers, people that are educators, thought leaders, can provide insight. And I look at it as we've got these pillars of care. So everything revolved around caregiving, family dynamics. How do we find support? Feeling seen in other people's story of caregiving, we can learn from that. We've got looking at how do we learn about dementia and Alzheimer's and FTD and all of the brain changes. How are we supported financially, and how do we navigate those systems legally if we have questions? How do we take care of ourselves? How do we have the wellness component? So looking at all of those aspects of how we care and empowering people that listen, a lot of caregivers or healthcare professionals, to feel equipped with information and hope and resources so that they can take all of that encouragement and knowledge and then fuel that into the world to make change, whether it's within themselves and their perspective or out into the world as they're helping support other people.
Oh wow. No, I think I think that's probably the first step to educate the public at large, or to bring knowledge to their doorsteps. Without that, it becomes very difficult, because with Google and with other social media information coming in, everyone thinks that they are the doctors themselves and they can cure themselves, which
Yeah.
actually doesn't happen in reality. And that is where I think people like you, who have the practical experience or the background, plus the passion and the commitment, as well as a vision to take it forward, So, Nikhil,
Mhm.
my question to you is like India is definitely going through a transition phase, and things
Mhm.
like podcast for senior citizens. I know of one of them in South, but definitely for a country of 1.4 million people,
Mhm.
one podcast somewhere in one town of India doesn't really work. So,
Yeah.
what I wanted to ask, because this is something which I've been discussing with people of how we should also do something on these kind of lines at a national level. So, what is the
Mhm.
kind of impact and effectiveness you think a podcast brings to the table on this particular subject? And typically,
Mhm.
who are the listeners who really benefit from it?
Yeah, well, that's a really good question. And in fact, I remember looking at my Apple charts for the podcast a little bit ago, and India was one of my top countries of people that listen. So that was so exciting for me. But the podcast, I believe we live in a really busy world, and we also are, lots of us are limited financially. And so to have the opportunity to listen while you're driving or caring for a loved one or folding laundry or taking care of your yard work. And it's a means to absorb information, whether if you've got a headphone in or, the audio on your phone, that is accessible and it's affordable. And I believe when we hear people's voices and the story that we're sharing, we see parts of ourselves in that story and can have those aha moments. We can learn, we can have the ability to take the parts that we want to take and implement it and maybe leave the rest if we don't find it applicable. But I always believe that lifelong we have the ability to learn and be curious about people and the world around us. And so the importance of that. I also listen to a lot of other podcasts, right? I like learning about different topics and subjects. And for me, it's a way to be able to multitask, right? While I'm going for a walk and listen. So I love the medium of podcasts, and I think it's really continuing to grow in terms of who's listening, specifically when I look at the data of the demographics of who listens to my podcast, it is primarily women in their 40s to late 60s, which when we look at the data in the US of who is the family caregiver, it's typically the eldest daughter. So I know that we're having an audience that is in that demographic of caregivers. Of course, I have feedback of lots of other people listening, a lot of healthcare professionals that want to learn from their colleagues or the older adults that they're supporting. But I wish we could have a glimpse into like all of the people that listen because we just have data, but it is exciting to know that people are listening. So.
So definitely there is a growing acceptability and a good impact which you feel is there. Okay, so
It
that is a
is, it is. Absolutely. And when we look at, I think of the impact of having the ability to share information broadly, you start creating societal conversations and addressing topics that I would love to see be a part of mainstream media or larger conversations. Last year, I had the opportunity to attend South by Southwest, it started as a festival in Austin, Texas with music and film, and it's grown to have educational panels. But people from around the world come and they speak and share, and it's a lot of even some celebrities, right? So our goal was we had this care sanctuary to support caregivers while we were going to some of the events at South by Southwest. And it's an example of moving conversations like dementia or virtual reality for older adults. Rendeavor is an organization that we were working with that got to speak on a panel there, and having it be in settings that are more public facing and having conversation in the broader scope of that. So I think we're moving in that direction in the US. We still have a long ways to go, so that it's just a part of what we dialogue about. When we think of caregivers, it's really all of us, right? It's like that quote I think Rosalind Carter shared about you either are a caregiver, you will be a caregiver, or you have been a caregiver, that all of us at some point in our life will be caring for someone that we care about. And so it impacts all of us in various ways. And we're all aging every day. I'm aging every day, day by day. We're all growing older. It's the one universal truth in our life is that
Luckily.
we are going to be older someday. Yeah.
That's true.
Yeah.
That's super true, Nicole. So I was talking to one of my seniors and he was like, "Oh, but we're having this problem and that problem." And I said, "We're so lucky. Thankfully, you're not alone. We're all going to age one day."
Yeah,
So we all
exactly.
need to find the solution to that problem, to be honest,
Right,
because
right.
it's not an individual problem anymore. It's a problem of
Yeah,
the whole population. Everybody's going to age. It's
yeah,
an irrefutable fact. So
yeah.
that's really interesting when you spoke about people that you have been in your podcast about. What do you think? Maybe a story that stayed with you, if you'd like to share with us, or something from your recent conversation that you felt really shifted your perspective towards
Mm,
aging in general, that you would love to
mm.
share with us.
Oh my goodness. Ah, that's so good. And so I've had over 200 conversations, 200 guests.
Yes, so we know it's
Oh,
a
and I
huge number. We
still can't
really,
say
but we really would
them.
love to know from you.
Yes, there's a couple. One, Dr. Jason Karlowish, he heads up the Penn Memory Center, and he wrote a book called The Problem of Alzheimer's. And it completely shifted my perspective from the perspective of it's been decades of how Alzheimer's research and care and history and politics played a role in how we provide care now. And the I love his perspective of he views it as when he is working with someone living with dementia, he views the family as also a part of who he cares for, that it really goes hand in hand. And as a physician, I love that care and education for the family. And I also love his ability to speak to how do we support families in meaningful ways and really look at our health system. He had such a good point. We don't have in the US, there's not a physician that is only focused on dementia. We don't have like a dementiaologist. It's fragmented. We have neurologists, we have psychologists, we have psychiatrists, we have physicians, and they're all working with families in some capacity or are part of the diagnosis process, but there isn't that one central. I know a lot of families have a challenge of receiving an accurate diagnosis. And so that was just a very eye-opening conversation. I suggest if you haven't read his book, it's such a good book. Sad but insightful. A couple other conversations. I had mentioned Dr. Charlotte Yeh. She was the chief medical officer for AARP, and her whole perspective on thriving emotion that, as we're growing older, she talks about not liking the term aging in place, that sounds so stagnant and that we're just sitting there and we're not doing
Yeah,
anything, right? But that
right.
regardless of whether our mobility or even our cognition and brain changes, we still have the ability to have joy and be active with our education or our relationships. And so can we continue to still like thrive in those ways? Um, Oh my goodness. I think some of my other powerful conversations has a caregiver, um, Andrea Crystal. She is a caregiver for her mom. She's young, and her mom has young onset dementia, and her ability to vulnerably share what those challenges are like for her being younger, and it's almost a life interrupted. And I really like to highlight hard but important conversations that we need to know. When we look at the demographics of caregivers, I want to say the data is like 40 some percent of caregivers are now ages 18 to 42, I believe. And so that's almost half of caregivers are young. And I think we talk a lot about, right, spouse or older adults that are in that role, but so many caregivers are in their 20s and trying to manage working and caring for others. So to have conversations around how do we help support younger caregivers. I loved the conversation with Lorenzo's house. I do work with them, and they are really shining a light on younger onset dementia and Alzheimer's, because a lot of times it's overlooked, it's misdiagnosed, and they have kids as young as, maybe 4 or 6 that are a part of their support groups that have a parent living with dementia. And I think we forget that it just impacts the whole family. And it's a diagnosis of the family. And the call for young people specifically is that if we're overcoming something hard, not even overcoming, but they're fueling uh, purpose into dementia justice. Okay, so what can I do about it? I'm a young person, but how can I have a voice and what can I do about it? So I could go on and on because I've had so many wonderful
No,
guests
that in
that
fact
those.
that is where I am now. My next question would be in continuation with that. That since you have been interacting with so many people and you have this kind of way to understand this particular subject, and typically uh, when it comes to the Indian perspective, or any developing country, what happens is we are either 10 years, 15 years, 20 years behind a socially developed nation. Things have
Mm,
changed now in a lot of other fields. It's changed, probably IT things have changed, but when it comes to aging, we are still trying to get our foothold in the country as such, as to how we should take it forward. So in your perspective, what do you think is going to be the main issues and challenges over the, let's say, the next 20 years,
mm,
both for the developed countries as well as for the developing countries, or let's say socially developing countries? So
yeah,
where do you
yeah.
think how things will happen? Because today's situations are very different, but I think another 20 years, that is where people like you and us as a role, who are
Mhm.
involved in the industry, should probably think as to what is going to be the future. So what are
Right.
your views on that?
Yeah, that's a big question. I'll do my best. Right, for developed and developing nations, I believe the challenge is twofold. We have capacity and then we have culture, right? If a part of each of our nations where we live. And in developed nations, we're facing caregiver shortage, right? The ability for our population to care for our older population. We have many more older adults than we do have younger generation to care for them. We have, as when I was sharing about the cost and affordability, escalating cost. We have our baby boomer generation, which is rapidly growing, and it's going to outpace the systems that are in place if we don't adapt. And I believe we have to address that isolation and mental health impact, right? Specifically, as in the US, a lot of families live further apart. There's also an entire conversation around the immense burden for family caregivers and caregivers. And I can dive into that a little bit later, but we already have critical workforce shortages. The demand is outpacing. We've typically that position of hands-on care has a lower wage. It is physically strenuous. We've got high burnout. It's not only physically demanding, it's emotional demanding. We are now, right, moving into a lot of people are talking about longevity. And longevity is wonderful, but people are living a lot longer, maybe not always as healthier. We've got um, chronic comorbidities like dementia, diabetes, heart disease, and all of that only increases complexity but cost. I think while we have technology that is growing, we call, that age tech, and it's booming and growing, but the adoption of it can be slower due to trusting the technology, the organization. Is the cost in line with something I can afford and implement? Are we having adequate training for older adults that are utilizing technology, or the families, or the staff? Social isolation, right? As families are living further apart, that risk of loneliness is only growing. An organization I'm supporting right now called Homesite is trying to address with older adults and home care that we have this ecosystem of a care connection platform to address the connection piece, to have insights into home and wellness and biometrics and building out engagement. So touching on social isolation, touching on health and data, and bringing the whole care team together. I think that we have a unique opportunity as well, as family is really also at the heart of those caregiving traditions. And I think that if we build systems that can blend how we support someone professionally with local support resources, with supporting the family, I believe that instead of a purely institutional model, it's going to evolve to really having systems in place to give the family the foundation that they need while being supported by organizations. In developing countries, and I would love to hear your thoughts on this, you're facing similar challenges where your aging population is growing right before infrastructure is ready. A lot of younger adults are moving towards urban environments, and there is how do we work with the limited resources we have as a developing country, right? So are there other pressing needs that have to be addressed, like transportation or infrastructure? And I think, the difference or the benefit is that typically you have stronger intergenerational bonds, right? And family care systems. And so it's going to be interesting to see how we come together as a global community and work together to help support some of those challenges. So, how about for you? Where do you see emerging challenges for India in the next how many years?
Honestly,
I know you're
Nicole,
making a big difference already.
no,
Yeah.
not at all. In fact, I mean, honestly, it's a wonderful question, and I wish somebody would have asked this question like 10 years back,
Mhm.
and would have changed a lot of things. But still, to begin with, it's a wonderful question. Why?
Mhm.
Because as we're talking about diseases getting more, I would say, younger onset. Let's talk about dementia, let's talk about Parkinson's, or any such chronic conditions. The more younger onset it is, that means whoever is the carer is also at much younger age group,
Mhm.
possibly the elder daughter, for example, we were speaking about. Most of the cases, it is the elder daughter or the child, right? And now this child let's say, has now two major issues to deal with. One is a parent who's probably just retired, is supposed to start with the second inning, maybe has things planned, but now things are going on the other way. They have an early onset dementia, they have an early onset Parkinson's, there are symptoms of Alzheimer's and other things around that, or maybe some other comorbidities that we aren't aware about, right? And they have a younger generation to care for, their own kids. So
Mm-hmm.
now in India, we're struggling with this generation, what we call as the sandwich generation, which has the responsibility, though we say in India it's a huge thing that the intergenerational bonds are amazing. They are
Mm-hmm.
people feel responsible for their adults and for their children, but then it's also a lot of added pressure on them because
Mm-hmm.
they are responsible for the adults and they are responsible for their own children here. So
Mm-hmm.
yeah, I mean, I feel it's with the change in the age demographic, with the longevity, and with early onset of certain condition, things are
Mm-hmm.
changing, and they're changing at a very fast pace.
Yeah. Yeah.
Yes, there is a huge caregiver shortage.
Mm-hmm.
Not everybody is able to care for their parents. Not everybody is available physically or financially. It's a possibility for them. And in India, it's a huge challenge of finding the right infrastructure to begin with. That is a
Mm-hmm.
struggle we have as a nation. But I feel to begin with all of this, knowledge is the key. We are aware that yes, there is this problem. That is how we
Mm-hmm.
can find the solution for the problem.
Yes.
Unless we
Yes.
aren't aware about the problem in general, there are no solutions possible.
Mm-hmm.
So I feel
Mm-hmm.
like small things, small efforts, like you doing your podcast, talking to people, and you telling me that most of your listeners are Indians. Honestly, I am not shocked because
Mm-hmm.
these are the generational people who actually need help,
Mm-hmm.
who actually are struggling with these practical issues.
Mm-hmm.
So
Mm-hmm.
I feel it's a huge thing. Knowledge being the key. And
Yeah.
then, yes, of course, other things like caregiver training, other complexities, especially complexity of the cost part. It's a huge thing for them, especially when
Yeah.
they're caring for two generations together.
Mm-hmm.
And in the
Mm-hmm.
meantime, taking out time for their own self-care is,
Exactly.
again, a challenge in all of this.
Mhm.
So
It
I
is.
feel, I think with the aging tech increasing and with the AI, new models developing rapidly, I think it'll be a huge help in
Mhm.
general to the population. That's my thought.
Mhm.
Pankaj, what do you think about it?
I am a very, very staunch advocate for this. And to be very honest, the reason of doing all this thing is because I don't see India as one country when it comes to a subject like this, to be very honest.
Mhm.
We
Mhm.
have two very clear verticals. One is the urban population and one is the rural population.
Mhm.
Irrespective of whatever we do in the urban thing, the rural will not be able to afford the same thing or the same level of caregiving what we are able to do it in the metros or whether into the larger cities. Because the cost of labor is going to be remain the same. The cost of infrastructure is also going up. So till the time we don't find two separate homegrown models, it will become
Mhm.
very difficult to bring them on the same living field. It's very nice to say that everyone should be able to get the same service. But point is that when you don't have the infrastructure at the rural level, when you don't have the manpower, when you don't have the knowledge, when you don't have that intention also of the bureaucracy and the government, how do you bring around change? So at the rural level, I personally feel it has to be more of a community driven because they still have certain roots.
Mhm.
At the village level, you have these the village head who is the authority today also. The government doesn't get involved, to be very frank. A lot of
Mhm.
decisions, they don't go to the police or they don't go to the authorities. They sort it out amongst themselves. So
Yeah.
these kind of issues will have to be decided at the village level, at the ground level. We have almost like zero point 0.6 million villages. We have
Mhm.
6 lakh villages. Just but it's not a small amount. And when it comes to the rural, urban part of it, definitely we have agencies, we have home care service providers, we have the government looking into all those things. So over there, you can't use that logic of okay, one head sarpanch or the head village head can decide. No, over here you have to have the law and order, you have to have those guidelines, you have to have those standards. So
Mm,
all those standards and everything, they'll have to be divided into two parts. One is what is acceptable and what can be implemented at the ground level, and one is what
mhm.
is idealistic and which should be done at the national level.
Yeah.
So yes, it's a long way. I would say it is a long way. But if we don't discuss and people don't listen to these kind of discussions, they will not
Mhm,
exactly what Megna said is they will not even realize the gravity of the situation.
mhm,
And
mhm.
we are sitting at
Completely.
11% of the population. We are almost like 150. We have 150 million elderly, which is probably more than the population of half the European countries.
Wow. Big, big.
It's
Yeah,
big,
yeah.
and out of that, 70% of them are in the rural. And
Mm,
out of that
wow.
70, almost let's say 75% of them also are purely poor.
Mm, yeah.
So the dynamics are very, very different when it comes to both urban and rural. But yes, we need to start somewhere. And I
Mm,
strongly believe in this thing. And when I talk to other people also, I said our objective is first educate the educated.
yeah.
Once they get educated, then the people who are associated or who are working in those areas, once they go back to their roots, at least they'll bring in certain good standards, like working in a five-star hotel or the best of the hotels. When a chef you go, you have certain knowledge, but when you have understood that standards, guidelines, practices, and when you open up
Um,
your own restaurant, by default you will use the best practices.
I love that. I love that analogy. Yes, absolutely. How are you finding that workforce or companies are supporting caregivers within their organization? Because you talked about, and same in the US, where you're caring for your loved one, you're caring for your children. A lot of times our work suffers and we have to take time away to do um, all of those things. Are you finding our organization supportive of supporting families that need to navigate that? Because it's a challenge in the US. I think we're having more human resource groups that are coming up with initiatives to support family leave and caregiver support resource. But how about, is that a conversation in India?
Yeah. Mrigna, would you like to answer that?
Yeah. So honestly, so far we have not seen these conversations going on, but some things are very cultural in India.
Mhm.
So it is automatically assumed that the child would be caring for the parents.
Okay. Yeah.
And here in that case, because of the cultural context of it, from our
Hmm.
HR policy to everything, generally the system supports it. Because the
Hmm.
person who's sitting in the HR is also somebody's son caring for somebody,
Yeah.
you know? And like you
Yeah.
said very well, either we are caring for someone, or we will be caring for someone, or we have cared for somebody in our life.
Hmm.
So I think
Hmm.
being such a huge population and having somebody to care for in your life,
Hmm.
and knowing that your parents have either taken care of your own grandparents, and knowing these examples, I think culturally it comes very naturally to us.
Hmm.
But
I could
yes,
see that.
with the development of more, I would say, corporate houses and
Hmm.
everything, these things are a basic part of the policies. Yes,
Hmm.
they do
Right.
get a lot of assistance
Yeah.
because of the cultural context of working in a country where kids are still living with their parents. It's not a taboo that you are a father of a 10-year-old
Hmm.
and you're still living with your own father. It's not a taboo
Hmm.
in this country.
Yeah. Thank you for
So
saying that.
that brings a lot of context to this question, I hope.
Yeah, it does. No, that makes sense. Thank you. Thank
Yeah.
you.
So I think has been a lovely, lovely conversation, Nicole, with you. And I think, though I do not wish to stop this conversation, but I would love to ask you my last question for this conversation. That would be, what do you think? What are your key recommendation or suggestions that you think that will make aged care more acceptable, respectful, and I would say generally dignified,
Mm,
especially when we're talking about aging in one's own place, or aging in a assisted living, wherever we're talking about. So, what is a
mm.
general key recommendation in this case?
Yes, there's two parts of that answer for me. I think advocacy, right? When it's personal, when we put face to the story, it becomes not just about numbers or statistics, but our humanness. And when we have visibility and advocacy and conversations like this and the work that you're doing, we can have greater uh, recognition of what those care needs are, funding for caregiver support programs, expansion of services. There are wonderful people that are on social media sharing their story and bringing visibility and advocacy. Jessica Guthrie, Andrea Crystal, Chris Pulisan, Emma Hemming Willis, Carrie Albers, I can name, right, people that are in a space where they're changing the conversation and they're changing the public perception. And I think that that's an important piece of it. I think if we change the narrative and show aging as growth and contribution rather than solely from decline or dependency. I think it's the stereotypes that we have shape how we treat ourselves or treat older adults as we grow older, right? If we expect it to be lonely, we might withdraw. Or if we expect that I'm going to be irrelevant when I'm older, we may stop contributing. And so I think challenging those narratives and looking at it as a time of deep connection and contribution and reinvention. I've learned so much from the older adults in my life, the ability to learn their wisdom, right, and their perspective. I also think it's important that we involve older adults and caregivers in creating products and services and policies, invite them in directly into those conversations. And I did a podcast with Dementia Action Alliance, and each guest that was on my podcast was living with dementia. And they were able to share their perspective and what it was like to receive care and how to be cared for. And all of those conversations are so vital because how do we care well for people when we're not including them in the conversations, right? Continuing to bring in the intergenerational connection. I know for the US, that's more of an important challenge because it is not as culturally right. Like, lots of families aren't living together like they might be in India, and so that is a piece of it. And also the language matters, using words that respect dignity, using terms that are not internalizing the negative language about aging, not using words like, frailty or the burden or right, we already hear some of that in our media, but in cultures where aging is associated with wisdom and leadership, you can see the language reflects that, right? Respected one, elder, and in cultures where it's not viewed in that way, we tend to be more dismissive about it, right? Or, oh, the sweet old lady, or things like that. And we don't want to, we need to be mindful of the language that we use. And I think the constant training of empathy and communication, using dignified language, normalizing talking about aging when we're younger in life, that it's not a crisis conversation, but it's a life conversation. And, the most powerful anecdote is spend time with older adults, right? You'll see that the relationships are vital and there's less possibly fear or apprehension when you can see that it is something that is embraced and respected and all of that. So that would be my advice.
Beautiful. I think uh, मतलब after all the guests I speak to, I get some kind of weird ideas as to what we can do. It may be out of the box. But Dr.
Mm.
Mrigna, I think what Nicole has said is something very right. I was just thinking, why don't we make a kind of environment or kind of a pitch where you make aging as aspirational? When
Mm.
you are in school, you want to go to the best school. When you're in college, you want to go to the best college. Okay, when you want to buy a house, you want the best locality, best this. Then why not the best retirement home? Or why not the best
Mm.
assisted living home?
I like
More
Yeah,
that.
no, that's
mobility
very
and
interesting
I
diseases
like
will
research.
that.
keep coming.
I I love your epiphanies and by the end of the conversation, and I love the new ideas that pop out of the conversation. And honestly, yeah, it can be something. It can be something we can think about, and I think it's interesting,
If you
especially
have
like
the money, then you should look for the best because all our lives, everyone wants the best. No one wants to say
Mm.
that, oh no, I want the second best only.
Mm.
yeah, no, that's true.
Yeah.
But I mean, coming back to what where we started from Nicole, honestly, the fact that we change our language and we change our jargons, that changes a lot of things. Like rather than saying caregiver stress or caregiver burden, the caregiver wisdom, or the I don't
Mm.
know, something like a
Mm.
positive association to the caregiving experience that one has had.
Right. Right. Yeah. And I do. I believe you can acknowledge that it can be hard and challenging, but I also think we are, and our mindset is shaped by the words we tell ourselves, right? And tell other people, and just to have the ability to pay attention to that. And I think it's important that while you don't want to dismiss someone's hardship, right? I think it's important to acknowledge that, but also language impacts us. There's research, and I can't say the exact ones, but how we speak out into the world is this internal lens that we start to then implement in our own mental health. And so having the ability to shift that so that we are not stuck in a place of overwhelm and despair, but that we can start to move forward and hope and wherever we can glean that from, and be then an encouragement to others.
No, I totally agree. In fact, I remember reading one of such studies. It says that especially words can change your brain chemistry. And
Mhm.
there have been neuroimaging studies that prove, that
Mhm.
especially program like neuro-linguistic programs, NLPs, that are called as, or a
Mhm.
self-talk technique where you are repeatedly rewiring your emotional responses to the brain. It really helps a lot. And I think the key or the basis start with the jargons we use, the words we are using, or how we're describing things to be.
Mhm.
Thanks, Nicole. I think has been
Ah,
very, very insightful and beautiful conversation for both of us here.
yes.
Oh, I've enjoyed
Thanks a
it
lot.
so much. Thank you for having me share, and I've loved learning from both of you as well. So thank you.
Thank you
Thanks a
very
lot.
much, Nicole. It was a pleasure to have you for this session. And don't worry, we will keep bouncing back questions to you and taking all your learnings and whatever we can use it in our context. And
Mm,
sincerely, really appreciate your coming on the session. Thank you very
Thank
much. Thank you.
thank you for having me.
Thank you so
Thank
much.
Okay,
you.
Dr.
Thanks.